Cyfarwydd Plaid Cymru, Rhina Piorwerth.
Diolch yn fawr iawn. In a written statement today, Minister, you say that asymptomatic testing of care home staff will now be undertaken through the UK organisation's portal and the Lighthouse laboratories, rather than testing being allowed through Public Health Wales laboratories. Given the problems with Lighthouse, many people will find that a disappointing and rather strange decision. You're not even saying that the Lighthouse problems have been resolved yet. Your statement says that issues are being addressed. Do you recognise that you're in danger of undermining confidence in this testing system for a sector that we all know is still very, very vulnerable?
Yeah, I've taken seriously the evidence from the whole sector, from the WLGA as both providers and commissioners, as well as providers themselves. We've also had engagement with trade union representatives too. So this is a considered position, having worked with the sector in advance of it. We're moving to a position where Lighthouse Labs, when it comes to their operation around care homes, are actually improving the turnaround. There are bigger challenges still in the in-person testing. We've seen some improvement. We want to see it improve further. And this provides a consistency of provision, because I fully expect that local partners will, as we see high prevalence rates at present, want to move to the more regular weekly testing rather than the fortnightly testing we're able to move to when we had low transmission and prevalence rates in the summer. That then means that our Public Health Wales capacity can be deployed to support community transmission outbreaks, which we know have increased. We know we're likely to need to deal with as we go through the winter. I just remind every member that we're in a position where we have a joint programme where we have Public Health Wales tests and a significant infrastructure created through a UK paid for and led programme. We're not in a position to simply opt out of that program, then replace all of that capacity ourselves. It's about money, it's about equipment, it's about people, it's our ability to deliver a system that will work for each of us as best as possible. So I'm not being complacent about challenges in the Lighthouse Lab program, but I'm recognising I think this is the right choice to make to provide some certainty, and indeed it comes on the back of an improving picture in the way that Lighthouse Labs are dealing with care home tests.
Improving, you say, and moving to a situation where they can deliver a decent system, a service, you say, but I'd rather wait until they can prove that they can deliver that service that we need. And you know, I'm not saying don't use Lighthouse at all. I think Lighthouse can be hugely important and will be hugely important, but surely we should be having as much control over what is possibly within Welsh Government control. We know from answers to written questions I've submitted in recent weeks that your policy is to leave things largely to UK government when it comes to vaccination too. There is growing optimism about the prospect of a much needed coronavirus vaccine becoming available in the near future. Can you tell me what your latest thinking is on this, and what Welsh Government's role will be in acquiring and running a vaccination programme in Wales?
I think it's a slight miscasting of the way that the system is actually working to say we're leaving it to the UK government. There are a couple of things to run through in terms of clarity. So the first is that the UK government, as it does with a range of other programs, including, for example, the seasonal flu, procures the vaccine on behalf of the whole UK. We then take our population shares of that. So we will get the vaccines that are available when they're available at the same time and in, if you like, the appropriate portion as with every other part of the UK. In terms of the advice we get about how to deliver the vaccine, we have a UK-wide mechanism that will give advice on vaccinations, on approval, and in particular the point about prioritising people, because whenever a vaccine is available, we'll need to, as the First Minister said yesterday, to consider how we deliver that to the most vulnerable population first, people who gain the biggest benefit. That will, though, also be subject to the important caveat that we need to understand the characteristics of that vaccine. Some vaccines may be more or less effective in people with different healthcare conditions, age ranges, and we need to make sure the vaccine is actually effective for the group of people that we're looking to offer it to. We are already planning our own programme for how we would deliver a vaccination programme here within Wales. And if we did have an early vaccine available before the end of the calendar year, then our plans are in such a position that we could deploy that for the limited group of people that we think a vaccine might be available for. So this is about planning, being able to deal with an early vaccine if we get one, and also dealing with a more realistic prospect of a greater number of vaccines becoming available to every country in the UK at the same time at some point in the new year. But I can't give people the sort of certainty that they and I would like about when those vaccines will become available.
I admire your trust in UK government. My fear, just like with testing and various other elements of what we've experienced over the past 7-8 months, including PPE and so on, is my fear is that you're afraid of taking as much control as you possibly could. Now, I've praised you in the past, and I'll do it again, saying Welsh Government has in many ways been at its best when it has decided, listen, for this thing, we need to get it done properly by doing it ourselves with absolutely the appropriate elements of and levels of cooperation and sharing ideas and so on. And you know, there's a danger that Wales, by not taking the bull by the horns as much as you possibly could, might be in a position where you can't press ahead with the programme as quickly as other parts of the UK. It was good to read in the GP's magazine, Pulse, yesterday, for example, about plans for a rollout in England before Christmas, which would be great. And with trust, I'll finish here, with trust being so vital for take-up, with Welsh Government trusted more than UK Government over this issue. You could argue that that doesn't say much, but won't a very, very clear and explicit strategy, clear and explicit communication from Welsh Government be a valuable weapon in building up trust and encouraging take-up, which we will need in coming months?
There are two things that I'd say. So the first is that we're taking the same approach that every nation in the UK is on the procurement and supply of a vaccine. So there's nothing unusual in doing that. And actually, whilst I can and will continue, no doubt, to be sharply critical of the UK government where I disagree with them, on the issue of the procurement and supply of vaccines, I just don't think there are grounds to suggest that the UK government would somehow advantage one part of the UK over another. It's why not just this Welsh Labour-led government is part of a UK-wide procurement programme. It's why the government of the Northern Ireland Executive, led by a combination of Unionists and Republicans, it's why the Scottish Nationalist government are also part of those same arrangements for the procurement and supply of the vaccine. The arrangements for the delivery of that vaccine are down to each of the four nations. And as I say, we already have plans that are being developed and worked through here for the delivery of a vaccine, and that would include the possible delivery of a vaccination program within this calendar year if a vaccine is available. And if we are going to do that, and if we do have a vaccine that is available to enable us to do so, you can certainly expect there will be direct and clear communications from the government and from our National Health Service about what we are doing and why, which groups of the public we expect to benefit from that, and how we propose to deliver that in practical terms. And in many ways, the delivery of the seasonal flu campaign is a helpful precursor to doing so. And I'm very pleased to say that we've actually had a greater uptake at this point in the year than last year, and that should provide population protection and coverage. And I really hope that is a longer lasting impact of this pandemic, that people will undertake their own seasonal flu protection in greater number in the future.
Question 3, Nick Ramsey.
Diolch, Llywydd. What discussions is the Minister having with officials, including those in Public Health Wales, about progress towards a vaccine for COVID-19?
As I'm sure you'll have heard, the UK government is leading the work on funding and procuring vaccines for each nation of the UK. The Welsh Government is working closely with key stakeholders such as Public Health Wales, health boards, trusts and local authorities on plans to distribute a vaccine when one does become available.